I'm gonna go over some rule of thumbs, because that was a question too. I'm gonna go over some rule of thumbs, and then I'm gonna tie it into some nerves as it relates to shoulders. And I want you to remember, on the test, you have multiple choice, right? On the test, you have multiple choice. And that means you can rule out 2 and keep 2 and pick from the best, right? In real life, your job, right? In real life, your job as a certified hand therapist is to rule in and rule out particular types of problems. All right. So if your job is to rule in and rule out particular types of problems, you have to know like the themes and stuff like that. Sometimes we get really complicated cases, right? So I've had some questions that come in that are like, hey, I have complex cases. There's a fracture, there's a flexor tendon, there's a extensor tendon, like the whole thing was, lucky that they still have a finger. So your thought process is really important in terms of what you're allowed to do, what you're allowed to do first, what you're allowed to do second. So the same thing goes with shoulders. There's a rule of thumb when it comes to shoulders and stuff like that. And I promise you, if you know half of the stuff, you can rule in and rule out the other half. Because I promise, when you get some patients in, you don't have to memorize it, right? You don't have to have it memorized. You just have to know a certain amount so you can say this is not the particular problem. And that applies because it's on the test. It's the same thing. You're looking at the story and you're saying, okay, what's the particular problem? So this guy comes to me on Monday. He's been having a lot of issues, right? And he writes to me this extensive email and he says, I've been having some shoulder, it's not pain, it's discomfort. And I feel it in my triceps and I suspect that it's C5 or C6, C7. And what's worrying me is that I feel really weak, have numbness down my arm, right? And I just don't want it to get worse. Make sure, right? So first of all, his language alone told me, hey, this guy knows something about something, right? And we're gonna have people come into our lives, into our clinics, and they're going to essentially be other healthcare providers, and you can't be scared because you know a ton of stuff, right? So a guy tells me he recently noticed numbness and tingling in my right arm about a month ago, and it lasted give or take 2 weeks. Severity mild. Sometime after that, I'd say 1 to 2 weeks after I realized that the arm heaviness specifically was involving my right tricep, attributing this issue somewhere between C6 and 7. Aside from the heaviness, there is discomfort. It can be considered painful to some, but I personally find it more discomforting than pain. Despite all this, I currently do have full range of motion, level of weakness grade 4. So and then he told me a story about like what happened to him as a child. This man is much older now. He wants to avoid surgery. Assuming that I have a pinched nerve, radiculopathy, etc., and no underlying disease, I do want to avoid surgery at all costs. This hasn't stopped me from doing my ADLs and all that stuff. It's the first time I have ever experienced heaviness, weakness. My main concern is that it's getting worse. I'm utilizing TENS, medication management, naproxen, Flexerol, ice and hot creams, and he's looking for answers, right? So he's looking for answers. So I'm like, who is this dude? So he was referred by another therapist. So I'm like, is he another therapist, or another healthcare professional to know that type of terminology? And so really, that terminology too. So here we have a potential shoulder and potential cervical nerve issues. So we're going to go over some things that you can rule in and rule out, and then from there I'll go into what I looked at, and I have some pictures to show what I look for. Now tie it, that's how I'll tie it, and then we'll cover some nerve stuff, and then we'll cover